Can't open your thumb after stroke? Fix it with these 3 exercises. Hi friends! Welcome back to another educational video with Dr. Rehab. Today we're focusing on a common post-stroke problem: thumb and palm deformity caused by spasticity. If you find this helpful, give it a like so more people can see it. This posture limits the abduction movement of the thumb, and since opposition is one of the most important movements of the human hand, the very movement that sets us apart from animals like monkeys, we must first correct the hand posture by bringing the thumb out of the palm before we can train proper opposition. So let's get started. I'll show you 3 very practical exercises to help improve this condition. Exercise 1. We place a thick surface, here I'm using an armrest, in front of the patient's hand. The patient tries to position the thumb to one side and the fingers straight ahead, with the web space between thumb and index fully stretched. From there, the palm slides down against the armrest surface, maintaining that open posture. This patient performed the exercise quite well. He mostly slid the thumb along the surface, but this still helped stimulate thumb release from the palm, exactly what we want in the first stage. Patient toe. This patient's fingers are relatively straight, but as you can see, the thumb is stuck to the index finger, making abduction difficult. With my assistance, we achieved some passive range. Now watch as he performs the exercise. He slides right along the edge of the armrest, and the space between thumb and index is looking better. The movement can be performed in different directions, depending on the condition of the hand. Patient 3. Iman. Iman has a clearly visible thumb and palm pattern. We made the exercise a bit easier for him and didn't require full finger abduction. Each time, he helps himself with the other hand to pull the thumb out of the palm. Persistence like this always pays off. Patient 4. Sedig. Sedig has significant spasticity, which strongly interferes with thumb movement. At first, the thumb wouldn't stay open at all, creating constant tension. But he didn't give up. He kept practicing repeatedly, and eventually he succeeded. This is the power of never quitting. Back to patient 2. Now, after a period of training, look at patient 2 again. The web space between thumb and index is much more open, and his movement is smoother. Small improvements add up to big changes. By the way, share this with someone who might need it. It could really help them. Exercise 2. Stretching technique. This is a stretching exercise that should be performed in a sitting position. Sit on a chair, place your hand on the table, with the fingers on one side and the thumb extended in the opposite direction. This stretches the web space between the thumb and fingers. For the best results, keep the shoulder and elbow lifted and avoid leaning on them, so that the weight of your upper limb is supported through the tip of your thumb and the tips of your fingers. Iman performed this stretch very well. He kept the fingertips on the table, stretched the thumb, and fixed the thumb pad on the surface. Notice the space under the web between the thumb and fingers. It's better to maintain that arch instead of flattening it. Also, avoid resting any other part of the upper limb on the table during the stretch. Exercise 3. Active movement after stretch. This exercise is best done immediately after exercise 2, and it requires no tools or equipment. I recommend doing it right after the stretch because it locks in the web space opening achieved during exercise 2, making it last longer. When you follow a stretch with active movement, the combination helps gradually reduce spasticity in that area over time. Patient 1. Here, the patient's hand is placed in mid-position on the table. He tries to bring the thumb pad and the finger pads together, then move them apart again. Because the movement is challenging, he adds a little trick movement, pronating the forearms slightly to bring the tips together and supinating to open them. Most patients aren't even aware they're doing this. Assisted version. Another way to perform this is by using the index finger of the other hand to push the MCP joint outward. This reduces the interference of spasticity and makes the movement easier. We recommend doing these kinds of exercises with high repetitions. Form 3. In this version, the patient holds the fingers with the unaffected hand and moves only the thumb. This is an excellent drill for improving opposition. You can see the changes in this patient after repeating the exercise over time. Very satisfying to watch, because this movement requires patience. I hope to share even more progress with you in the future. Iman. Our cheerful patient Iman also tried this exercise. We kept his hand in mid-position, but since elbow extension was difficult for him, we adapted and stuck with a version he could manage. Remember, adapting exercises keeps patients engaged and progressing. Sadeg. Sadeg still has very high spasticity. He had to keep his fingers flexed with the forearm pronated, moving only the thumb. Even this thumb movement is a huge step forward for him. Persistence will pay off. I'll make sure to share Sadeg's progress with you in the future. Final patient. The last patient started by placing both hands on the table, using the unaffected hand to mimic the thumb movement. Then, he tried it with one hand only. After a bit of effort, the movement began to appear. And now, after consistent practice, you can see remarkable improvement. Remember, this movement can always be modified to make it easier. Whatever your current condition is, don't skip the movement. Just perform it within your own capacity. As you can see from my patients here, many of them work through challenging conditions and never give up. They keep going until they get results. Follow for more videos like this. And thanks for watching with your kind and encouraging spirit. And thanks for watching with your kind and encouraging spirit.